Hello, my name is Dr. Dewan S. Raja. Today I will discuss about fibroskeleton of the heart. The fibroskeleton of the heart is a complex framework of dense collagen. So this is a type of connective tissue that supports the heart and its valves and regulates electrical conduction system. It plays several key roles. Number one, structural support, valve anchoring. The fibroskeleton forms the basis for the attachment of the four heart valve, tricuspid or right atrioventricular valve, pulmonary semilunar valve, mitral or bicuspid or left atrioventricular valve, and the aortic semilunar valve. It ensures that these valves remain in their correct position and maintain their integrity as they open and close. The fibroskeleton maintains the shape of the heart by providing rigidity. The skeleton maintains the shape and integrity of the heart chambers. So we are saying we have four rings. This is the tricuspid valve or right atrioventricular valve. It has three cusps, one, two, three. This is bicuspid or left atrioventricular valve, two cusps, one and two. These two are large rings. We have two small ring or cornet, these two. And we have the trigone between the aortic valve and the atrioventricular valve, mitral and tricuspid valve. We have the left fibrous trigone. We have the right fibrous trigone. Okay. And we are getting contribution from the interatrial septum, membranous part. Okay. And also the membranous part of the interventricular septum. So they contribute in the formation and maintenance of the fibroskeleton of the heart. We have the interleaflet triangles, both for the aorta as well as for the pulmonary trunk or pulmonary artery. This is pulmonary artery, this is pulmonary trunk, this is another branch of pulmonary trunk, pulmonary artery. We are getting conus ligament for the conus arteriosum, from where the heart, from which part of the heart pulmonary trunk arises. We have also tendon of Todaro that is essential to maintain the triangle of Koch in the interatrial septum in the right atrium, and that is the location of the AV node, the triangle of Koch area. One of the boundaries done by the tendon of Todaro. So we got the anchoring, then our function electrical stimulation. Fibroskeleton electrically isolates the atria from the ventricle, ensuring that electrical impulses follow the correct pathway through the heart, specifically through the atrioventricular AV node. This ensures that atria contract before the ventricle, allowing for efficient blood flow. So atrial systole followed by ventricular diastole. So they don't go together in systole. So atria has systole, ventricular diastole. So blood will go from atria to the ventricle. Attachment of the myocardium. The fibrous skeleton serves as an attachment site for cardiac muscle. So for the atrial muscle, fibers come from above. For ventricular muscle, fibers come from below the fibroskeleton of the heart. Okay, this is the fibroskeleton of the heart. Atria has been removed. We are seeing four rings, two large rings, two small ring or cornet, and we have the connective tissue. This is connective tissue led fibrous trigone between the aortic valve and the left atrioventricular ring. and also from the aortic valve to the right atrioventricular ring. This is the another trigone. The right trigone area is here, and this is the conduction system of the heart. Okay, this is the right trigone include this part, this trigone area, triangular area. Left trigone area comprises this part, this triangular area. This is fibrous tissue, and here we are seeing the atrioventricular bundle, the only communication between the atrial muscle and the ventricular muscle by this part of the conducting system of the heart, atrioventricular bundle. Okay. So what are the components of the skeleton of the heart? Fibrous skeleton composed of four fibrous rings, each encircling a valve, two trigone, and membranous portion of the interatrial, interventricular, and atrioventricular septa. Annulus fibrosus. These are the rings that surround the bases of each heart valve, tricuspid, mitral, aortic, and pulmonary. They provide a firm base for the attachment of the valve cusp. Right and left fibrous trigone. These are triangular regions of the fibrous tissue that connects the ring around the valves. Specifically, especially between the aortic valve and atrioventricular valve. Tendon of conus and pulmonary fibrous ring. This structure reinforces the fibrous skeleton in specific area like conus arteriosus and the beginning of the pulmonary trunk. And that's all about the fibrous skeleton of the heart. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.